Good morning to you, and good morning to you who make this broadcast possible, and to all the people who follow us daily among our population. I want to make public the gratitude that they give us on the street and on the different messages that we receive concerning the information we provide every day here. And thank you very much for that recognition. First, we have to start by giving our condolences to two families, two groups of colleagues and friends for the death of two people yesterday. One is a 79-year-old female patient from Havana, from Marianao municipality, who presented a group of conditions such as end-stage lung cancer, high blood pressure, ischemic heart disease, and obesity, who had been in the hospital for a significant number of days since April the 22nd. She had been in intensive care. She had spent 13 days in the ICU, and she was actually reported at certain times as in critical condition and as serious condition yesterday. Despite the efforts and the treatments, and also taking into account her history, she unfortunately died in the early hours of yesterday. We are very sorry for her death, and we reiterate our condolences to her family, friends, and loved ones. The second person who died, also a Cuban, was an 82-year-old male patient from the municipality of Colón in the province of Matanzas, who presented a prostate cancer and frequent respiratory infections. He had been in the hospital for 13 days. He had been in the ICU for 6 days, and he had already been reported in previous days as in critical condition. And despite the efforts by our health professionals in the care and the treatments he received yesterday, he had a cardiorespiratory arrest, and unfortunately he died. And for this reason, we also reiterate our condolences to all his family and loved ones. In Cuba today, there are still 6,687 Cubans residing abroad and 4,388 foreigners. Cuba maintains a figure similar to that given in previous days. The number of foreigners staying in rental houses remains the same, 945. The largest number of them are in Santiago de Cuba and Centro Havana, Plaza and Playa municipality. Until midnight last night, 2,543 patients had been admitted to Cuban hospitals. In surveillance, 58, in suspects, 1,764, and confirmed 721. In primary health care, a total of 6,188 people are being monitored. To detect the presence of SARS-CoV-2 and the possible presence of COVID-19, yesterday 1,997 samples were studied. The largest number was taken at the Pedro Curie Institute of Tropical Medicine IPK with 703, at the Molecular Biology Laboratories of Santiago de Cuba Province 373, Villa Clara 288, in Havana 282, in the Genetic Engineering and Biotechnology Center 211, at the Laboratory of the Molecular Biology of Hermanos Almejeiras Hospital 94, and the Laboratory of the Civil Defense 42. Of these 1,997 samples that were studied yesterday, 19 were positive. That represents 0.9% of the samples studied. In this way, the country has already accumulated a total of 55,542 samples taken, and 1,668 people have been confirmed with the presence of COVID-19, which represents 3% of the samples studied. The 19 cases confirmed yesterday were Cuban, which has been happening in the last few days. 13 or 68.4% were contacts of confirmed cases, and which is a very important risk group. And already here in Cuba, of all the cases that have been confirmed, 1,433, that is 85.9% of the cases that have been diagnosed, have been related to a person who had already was confirmed previously as a carrier of COVID-19. This denotes the risk, and it is the reason why every time a case is confirmed in our country, we look for, as I have explained, as many people as possible who have been in contact with that confirmed case in the last 14 days. And an important group of these people, practically all of them, are isolated. They are admitted to hospitals, they are taken to isolation centers, and they are also studied. And their evolution is followed during the 14 days in case any of them has already been infected. And yesterday, Comrade Luis Torres Iribar, Havana's first secretary of the Cuban Communist Party, made this observation to us. He was asking us to explain to the population that wonders where these people come from who are being confirmed daily. Well, they come precisely from these contacts. Previously, they were foreigners who arrived and who often came with the infection. Still, since there is no massive influx or small influx of foreigners into the country, that has diminished. Therefore, all these people, which is also the concern of the population, and that is what Comrade Torres Iribar was telling us yesterday, all these people are usually admitted to a hospital or to an isolation center. They have been admitted because they have had contact, because they have had an epidemiological element of risk, and they are diagnosed in this place. This doesn't mean that sometimes population studies are carried out and they are found in some cases, but it is the minimum. As I said, 85.9% of confirmed people in our country have been contacts of previously confirmed cases. Yesterday, in 5 cases, the source of infection could not be identified, and therefore we currently have a total of 68 cases accumulated in this condition, in which the source of infection has not been established. One of the cases diagnosed yesterday had a contact with an asymptomatic foreigner. Of the 19 diagnosed cases, 10 were female, and 9 were male cases. The female sex was slightly higher. And in terms of all the confirmed cases in our country, the sex ratio is almost the same, with 51.6% are male, with 861 who are male. As of yesterday, 16 of the cases were asymptomatic. That is, 84.2% of the 19 cases diagnosed were asymptomatic. Hence the importance of this group in the studies being conducted. On the behavior of the epidemic in our country, 46.8% of the diagnosed cases have been asymptomatic. Of the 19 cases confirmed yesterday, the province with the highest representation is Havana, which confirmed 16 of the 19 cases, that is 84.2%. The highest percentage, not to mention that practically all are over 20 years of age, the highest percentage in the age group are those over 20 years of age. In the 20 to 39 age group, there are 10 people. In the 40 to 59 age group, there are 7 people. And in the 60 years of age and more, there are 2 cases. Yesterday, we were also requested to inform this by population rates, which we will be presenting in the coming days. It must be said that of the 1,668 patients diagnosed with the disease, 712 or 41.6% of those diagnosed have a stable clinical evolution. As we explained at the beginning of our presentation, with the 2 deaths reported yesterday, a total of 69 people have died in our country, which keeps us in a lethality of 4.1%. There are 2 people who have been evacuated. I was asked what this evacuation is. Well, they are 2 foreigners, an American and a Canadian, who during the evolution of their disease, when they were already a little better in their symptoms, they had not been discharged yet, but their relatives decided to transfer them to their countries. They put on a plane for each one, and they were returned to their respective countries, practically recovered from the disease. So they were able to travel with a group of measures. That is what we mean by evacuated. Yesterday, there were 49 discharges. That makes a total of 876 releases accumulated up to yesterday, which represents 52.5% of the cases that have been diagnosed. Of the 176 children's cases, 90 have already been discharged. The group of children under 1 year old is 10 of these 176, from 1 to 4 years old, 25, from 5 to 9 years old, 44, from 10 to 14 years of age, 48, and 15 to 18, there are 49 confirmed pediatric cases in these age groups. By province, the highest number is, of course, in Havana and Villa Clara, which have 52 and 28 cases respectively. But cases are being diagnosed in virtually all provinces. We have even had foreign pediatric cases, and I remember in Ciego de Ávila 2 French cases. I remember in Cienfuegos 1 case too. So it is a group that has a significant number of cases. What happens is that their evolution is not as complicated or stupid as that of the adults. Now, turning back to the lethality, it must be said that this 4.1 lethality in our country means that Cuba is still in number 12 compared to the rest of the countries in the Americas. The lethality rate in the Americas is 5.8. Within the region, as I said, Cuba with a rate of 4.1 is on the 12th place, but significantly there are other countries like Nicaragua with a rate of 14.3%, St. Vincent and the Grenadines 12.5%, Antigua and Barbuda 12%. Guyana 11, Haiti 9.4, Suriname 10, Honduras 7.52, Mexico 9.33, Canada 6.29, Brazil 6.99, and the United States of America 5.86. We have to report today as well with some regret that we have 3 patients in critical conditions and 6 in serious condition, 2 less critical than yesterday and 2 less in serious condition than yesterday. This is the situation in our country. As of yesterday, 184 countries were reporting the presence of patients with COVID-19, with a total of 3,388,665 confirmed cases. We are talking about 81,065 cases confirmed on a single day. We also saw today on the Telesur ticker tape that Brazil already had around 100,000 confirmed cases, which is a very alarming figure. And it's even more alarming that 4,881 people died in a single day, and a total of 243,312 have died. The world's lethality is of 7.18% as of yesterday. In our region, in the Americas, 43,722 cases were confirmed yesterday for a total of 1,434,136 confirmed cases, representing 42.3% of the total reported in the world. In a single day, 2,451 patients died from COVID-19 in the region of the Americas, and 83,135 died from this disease in the region of the Americas, which gives a lethality for the region, as I said before, of 5.8%. And here's the information we had to give you in terms of the situation in our country and in the world.